Hello, everyone, and welcome to our webinar today. My name is Cindy Clowner, and I work here at the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And today we're going to talk a little bit about ScreenU and how we can utilize that on your campus. So thank you for joining us, and we will go ahead and get started. Before we get too far, I do want to go over a couple of housekeeping things. I'll be happy to answer any of your questions that you may have that might come up throughout the webinar. Go ahead and type those into your chat box on the control panel on the right-hand side, and at the end of the webinar, I'll be happy to answer any questions that you have. The Higher Education Center is a partnership between the College of Social Work, College of Pharmacy, and the Office of Student Life here at The Ohio State University. And we are here through the generous funding from the Conrad Hilton Foundation. In addition to our partnerships between Social Work, Pharmacy, and Student Life, we are happy to partner with the Generation RX initiative. You can learn more about Generation RX and the university resources that they have recently launched at generationrx.org, as well as supporting the collegiate recovery community here at Ohio State. So today we are going to spend some time talking about ScreenU, why we created ScreenU, what the experience is like for both students and staff, and how campuses can utilize it. But I think the first thing that will be important for us to do is just a better understanding of what SBIRT is, because ScreenU is built on the foundational principles of SBIRT. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. So SBIRT is an early intervention opportunity with students. The hope is to identify students through screening, provide a brief intervention to them to help reduce their risk of experiencing negative consequences from alcohol or other substance misuse, and early identify those who are on the trajectory for developing a substance use disorder and connect them with resources, potentially treatment if necessary, so that they get the assistance and the support that they need. So SBIRT has historically been delivered in healthcare settings. It began really in emergency departments, and so people who would come into the ER would be screened to identify if they have a substance use disorder or at risk for a substance use disorder. And based on their screening results, they would kind of go down a couple of different paths. If a person came in and they did not screen at high risk for a substance use disorder, or maybe they're abstaining from use, a healthcare professional would reinforce that positive behavior if they're abstaining or if they're using in a low-risk way. However, depending on their risk level, they may receive a brief intervention. So if someone has using at a high-risk level, they might receive that brief intervention, and that intervention is really founded through motivational interviewing. And so utilizing the principles of motivational interviewing to evoke change within a person, to help them start thinking more critically about their use, how it might be impacting their lives, and how a change in their use might be beneficial to them. Those who are at severe use or may be likely dependent would be referred on to treatment. So I'm curious, now that we know a little bit about SBIRT, to learn a little bit more about whether or not you're using it on your campus. So I have a poll question for you, and I'd like to know, are you using SBIRT on your campus? Maybe you are. I'm thinking more traditionally about in-person SBIRT, although I looked at a few of you are campuses that are using ScreenU, so that can count as well. Maybe you are not using SBIRT on your campus, or maybe you're just not really sure if you are or aren't. So I'd love to know more. Okay, so let's take a look at our responses, and it looks like 50% of you are yes, using SBIRT, which is fantastic, and we think in-person SBIRT is a really great tool that campuses can be implementing with their students, and the other half are either not sure or are not currently using SBIRT. And so we developed SBIRT for a number of reasons that we're going to chat about, or we developed ScreenU for a number of reasons that we're going to chat about, but I want to take a look at some of the research behind SBIRT. Now, we have the citations for all of this on our ScreenU website. So if you visit screenu.org, you're able to find some journal articles around research using SBIRT, and this is all specific to college students. So there's a pretty significant body of research around the use of SBIRT with college students focusing on alcohol. There isn't as much research around other substances. So what we have seen, though, is that the use of SBIRT has shown to reduce the typical blood alcohol content as well as the peak blood alcohol content in college students. It's also been shown to reduce the peak number of drinks that a student consumes per setting, as well as the average number of drinks a student might consume per week, and the number of drunken episodes per week as well. And as I mentioned, although the body of research around the use of SBIRT for other substances with college students is much more limited, what is there has shown that SBIRT has shown an overall reduction in substance misuse, including the frequency of marijuana use as well. So if you're interested in learning more about the research behind SBIRT, I encourage you to check out our page at screenu.org. If you go to What is SBIRT, you'll find the links around research there. So as I mentioned before, we really love the idea of campuses implementing in-person SBIRT on their campus, but we know that there's some challenges to that. SAMHSA has historically provided some grants for campuses to implement SBIRT in their student health center, and what we have heard from some of those campuses is that it's challenging to continue the program once that funding goes away, and there could be a few reasons for that. One, in-person SBIRT requires training. As I mentioned, that brief intervention piece is really focused on using the principles of motivational interviewing, and so a clinician would need to be trained in motivational interviewing to be able to implement SBIRT effectively. Because of that training piece and the fact that it's done one-on-one, SBIRT can be time-intensive to deliver. And that one-on-one piece can really cause some constraints for campuses when it comes to implementing SBIRT. And one of the other pieces, and quite possibly the reason why we wanted to develop ScreenU, was that in-person SBIRT can be hard to implement on a large scale. So the idea behind SBIRT is to implement it at a population level. So anyone who walks in through the doors of your student health service would be screened for substance use disorders. And that might be possible, but that only reaches the students who walk through the doors of your student health center. So how can we reach students who maybe are not engaging in those small groups on campus or small departments on campus, and how can we reach more students on a larger scale? And so the combination of all of that led to the creation of ScreenU, which is a digital version of SBIRT. So it follows the principles of SBIRT that we have discussed, and it is all done on a web-based platform. So students can take this program on their phone, their tablet, or their laptop, and they don't have to download anything to be able to have access for it. It identifies students who are at risk for alcohol, prescription drug, or marijuana problems, and can connect them with resources that are local to your campus and community. So a few benefits of ScreenU. As I mentioned, it's web-based. The screening is also anonymous, so students only enter limited demographic information that you'll see in a moment. We do not ask students to enter their name, their email, or a student ID number to be able to access the screening. It's brief. Students can take the screening in 5 to 10 minutes. Of course, students who are not misusing a substance, it'll be even faster for them to be able to complete ScreenU, receive their positive reinforcement, and be connected with resources. It doesn't require any training to implement. So ScreenU is very versatile in the sense that it can be deployed to students directly, and they take the screening without the partnership of a campus professional. However, we have a number of campuses who are using it in partnership with campus professionals. So there's a lot of opportunity and versatility with the ScreenU program. And one of the things that we like the most about ScreenU, and we've heard a lot of positive feedback from other campuses that are using ScreenU, is the fact that it connects students with resources. And those resources are populated by you, so they're local to your campus and community, which is really important. And we know that students might be on your campus for 4 years and never know how well supported they are. They don't realize all the resources that are around them, and here's an opportunity to put those resources right at their fingertips, making it easy for them to access. ScreenU also provides real-time reporting to campuses so that they're able to see in aggregate the risk level of the students that they are screening, as well as how they respond to questions. And we'll take a look at the reporting here in a moment. And finally, ScreenU provides customizable elements within it, so it can be branded to look like it's coming from your campus. We'll use your campus logo within it. You also are able to customize the welcome and thank you messages that students see. So there's opportunities for you to make it more personal for your campus. So you'll notice that ScreenU really follows the same path that in-person SBIRT does. It's just all done digitally. So it begins with a screening. As I mentioned, we have ScreenU alcohol, marijuana, and RX. And so we use different screenings depending on the tool that you're engaging with. So for ScreenU alcohol, we use the audit, the Alcohol Use Disorder Identification Test. It was developed by the World Health Organization, and there's significant research around the validity of the audit. We also, for ScreenU marijuana, use the QDIT-R, the Cannabis Use Disorder Identification Test revised. So the revised version is a little bit briefer, but has the same validity as the original version. And for ScreenU RX, we actually developed a tool in-house here at the Higher Education Center, and we did that for a couple of reasons. One, we found that when we talk about prescription drug misuse, there really isn't a lot of screening tools out there for that. Oftentimes it just falls into the bucket of drugs, and that's not really what we're looking at. We're looking specifically at prescription drug misuse with this ScreenU tool. The other piece is we wanted to be able to provide feedback to students based on why they might be misusing a substance, and there weren't screening tools that would allow us to do that. And so we developed a tool in-house, and at the end of the webinar, in your follow-up email, you'll receive some sample screening links to be able to work through those and share those with colleagues, and you'll have the opportunity to see from start to finish how a ScreenU screening works. Once a student responds to the screening, they receive risk level feedback, so feedback that is specific to the risk level that they screened at. Then they move into some open-ended questions that simulate the motivational interviewing process. And finally, they complete the screen by receiving resources and strategies to reduce their risk. Again, those resources populated by you. So now we're going to dive into a screen. So I'm going to walk you through some screen grabs of our ScreenU marijuana program. So you're going to take a look at some of the images that students would see as they're working through the screening. Of course, some of these will be different depending on how you respond to the screening, and that's why I think it's so important that you are able to work through a screening on your own. So we'll provide those sample links to you upon completion of our webinar. So this first page is our welcome message, and it's pre-populated within your dashboard. However, you're able to customize this by campaign for students. We collect 3 demographics. We ask students their gender, their class rank, and their age. And we also ask about your state when you're using ScreenU marijuana, because we provide some state-specific feedback around the legalities of marijuana. And so we want to know what state you're in to determine that legal status. The next step is to go through a gateway question, and so marijuana is a little bit different than alcohol and prescription drug in that they use a 1-year time frame. However, the QDIT-R uses a 6-month time frame. So we're asking students to consider if they've used marijuana in the last 6 months, if they have a physician recommendation for use of marijuana for a specific medical condition, and if they're using it consistently. And based on those responses, it will send a student to down a different path. based on how they respond. So a student who says, no, I've not used marijuana in the last 6 months will receive some positive reinforcement. A student who indicates that they're in recovery are going to receive recovery-specific resources. And so here's an example of what that might look like. So we want to show our support for those students who are in recovery, congratulate them for a job well done and the work that they're doing, and connect them with resources that they may not even be aware exist that can help support them in their recovery. If you have a campus collegiate recovery community, that resource can be populated here, as well as support group meetings. And so what you're seeing in those teal bars are all things that we have populated on the back end of our dashboard, and they represent resources that are here at Ohio State. You have control of populating different resources that would be applicable to your campus. So it's okay if you don't have a collegiate recovery community. It's okay if you don't have support groups that are happening on your campus, but there probably are some kinds of resources available, whether they're happening on your campus or within your community, that you can help connect students to. One of the other things that we ask campuses to identify, even if they don't have a collegiate recovery community, is someone that would be considered a recovery ally. Maybe that's you. That is listening to this webinar. Maybe it is someone out of counseling, maybe it is someone out of health promotion, maybe it is someone that is a part of your collegiate recovery community, but a person who is familiar with the resources both on and off campus that can help provide a warm handoff to students to connect them with the resources that are available. As I mentioned, students who answer no to that gateway question receive some positive reinforcement. So this is an example of that positive reinforcement for ScreenU marijuana. So we want to encourage people that, yeah, that's great that you're not using marijuana or other cannabis products. We want to also arm them with some information if they have friends that are using marijuana. And so you see here some suggestions on how their friends might be able to reduce their risk of experiencing negative consequences. And then we also want to be able to give them resources in case they're concerned about a friend's drug use. So there's a link available for that as well. However, if a student answers yes, they are using marijuana, then they will complete the audit. So, or I'm sorry, the Q to R. So they're going to move through all of those questions with the Q to R. It's an 8-question screening, and it screens for a cannabis use disorder. And then the next piece is unique for ScreenU marijuana. So we're asking students some consequence questions. Have you experienced any of these negative consequences because of your marijuana use? So we're asking students to identify if they've experienced any financial burden from their marijuana use. Are they using marijuana and alcohol at the same time? Are they driving, operating a motor vehicle, or being active while using marijuana? And are they experiencing any academic consequences associated with their marijuana use? So based on how they respond to the Q to R, as well as the consequence questions, will determine what kind of feedback they receive in these next couple of screens. So in this example, this is our risk-specific feedback, and it indicates that the person who responded to the Q to R is using infrequently. So we still want to identify that there might be some risk even using infrequently, and identify what some of those risks are. And this is also where you'll find that legal content around the legality of marijuana use. And so if this is representing a state that has legalized marijuana to use it as medicine, and so we encourage campuses to, or we encourage students to be thoughtful about the fact that even though marijuana might be legal for use as medicine or even recreationally in their state, campuses still maintain drug-free policies on campus, and so marijuana would be illegal to use under federal law and under most campus student conduct policies. And so that text right there will change depending on the legal status of marijuana in the state that you are in. Once a student receives risk-specific feedback, then they receive feedback based on their consequence questions and how they responded to that. So in this example, we have someone who indicated that they're using marijuana and alcohol at the same time. And so here's some of the feedback that they receive based on that yes response. So for every yes answer that a student responds to within the consequence questions, they'll receive specific feedback geared towards that risk. Once students receive their feedback, we move into that brief intervention piece that uses open-ended questions simulating the motivational interviewing process. And so these 3 questions are intended to help evoke change. And so we're asking students to consider the marijuana use in their life and the impact that it might be having. So these 3 questions are a little bit different based on the program that you're using. And so we're asking students to think about if there was ever a time where they felt like maybe they needed to change their marijuana use and how they might know about that, what the positive impacts might be, what would be really hard about changing their use. And then students move through readiness scales to be able to identify how important it is that they can make a change, how confident they are that they can make a change, and how ready they are to make a change. And so they can rank from 0 to 10 how they feel about each of those questions. And after the readiness scale, they're faced with another open-ended question or 2 that is responsive to how they responded to the scale. So this last one around importance, we indicated a 9. So a 9 sounds like it's pretty important to a person. And we want to have people start thinking about who might support that change because it's something that they think they should be doing because it's important. So who can help them do that? We ask students about how confident they are they can make a change. And you'll notice in this case, I think it might be really important, but I'm not sure about if I have the confidence to do it. So I scored that at a 5. And so again, we have some open-ended questions. We want people to think about, well, why are you a 5? You could have been a 3. So you're moving further down on the scale, which is good. So why do you think you're a 5? And what would it take to push you even further up the scale to a 7? And I think it's important to note that we record these open-ended responses and you have access to them in a CSV in the reporting section. So you're able to see how students respond to these open-ended questions. And then finally, the last scale that we ask is about how ready you are to make a change. So maybe I think it's really important. I'm not super confident that I can do it. I just am not ready to do it. I know I should, but I'm not ready. And so maybe I put that at a 2. And so the questions that I'm asked affirm my choice. It sounds like you're not ready to make a change right now, but you're not at a 0. So that's good. Why are you at a 2 and not a 0? And how will you know when it's time to think about changing? And these questions, again, will change depending on where a person ranks their readiness throughout these scales. Once a student responds to all of those open-ended questions, then they receive resources and strategies to reduce their risk. The resources, again, are populated by you in your dashboard for ScreenU, and the strategies to reduce their risk are based on some harm reduction approaches around how to reduce their risk of experiencing negative consequences related to their marijuana, alcohol, or prescription drug misuse. Now, students have access to those resources by emailing, printing, or downloading that resource page, so they are able to see it later. Those boxes, the teal boxes, expand so that students are able to see where a resource is located and how to contact them. You also have the ability to add a descriptor to those resources, so you can add an extra line about what the resource name is, how students should interact with them, or any other information that would be important for a student to know when they're reaching out to those resources. We also provide a certificate of completion that students can download, print, and email to themselves that can be used to help track completion. So that's our screening, and we are going to take a look now at the dashboard. And this is what you would see as a campus administrator for ScreenU. So what we're using right now is our demonstration dashboard, and it is where we send all of our demonstration links. So if you've already received demonstration links, this is all of those are associated with this account that we're looking at. And I say that because I think it's important for you to know that as you're looking at the teal bars around campus data on this first graph, this is not student-specific data that we're looking at. This is data that has been entered through testing links by people just like yourselves, maybe even some of you that are listening in, as well as our staff here as we're testing the program. And so that campus data, those teal bars, are not representative of student data. However, those purple bars for national data are representative of student data in aggregate that we've collected from all of the campuses who are using ScreenU with their students. So we're looking at, of the students they screened nationally, a little over 40% of them reported that they are screened at a low risk level for alcohol use. So we're able to compare how our campuses to how campuses are screening, or how students nationally are screening. You're able to see on the left-hand side our menu of all of the different options, and we're going to walk through a couple of these pages. We're not going to go through all of them, but we want you to see the important ones here. One of the things I want to mention is earlier I had said that there's customizable options, and our Higher Education Center logo is up at the left-hand corner of this account because it's our Higher Ed Center demo account. However, your account would have your own campus logo there. And that's the same for screening links. Students would receive a screening link that has your campus logo rather than the Higher Education Center logo. ScreenU uses campaigns to deliver screening links to students, and so it's important to be thoughtful as you're creating your campaign about what exactly you're looking for. What are your goals when you're using ScreenU? What do you want to see out of it when it comes time for reporting? So, for example, if we're screening student athletes, there's a couple of different ways that we could do it. Maybe we're just interested in general student athletic data. And so we might create a campaign that is entitled Student Athletes, and it might go out to all of the student athletes, and we would collect all of their data in one report. But because we can only drill down in our reporting by those demographics questions that we mentioned, gender, class, rank, and age, there's no way for us to determine of all of these student athletes, was there a athletic team that was at a greater risk for a substance than another? And so if that's something that you're interested in, you could create a campaign that's individual for each student athletic group. So you might have a men's soccer campaign and a women's basketball campaign and so on. So it's important to be thoughtful about what you want to see in the reporting as you're creating campaigns. So we name our campaign, we identify a program. As we mentioned, we have the alcohol, prescription drug, and marijuana, and they're all delivered independently of each other. And then we also have the ability to assign the campaign a department. And this is might be helpful to some of your campuses who are concerned about how people might be accessing the reporting. So the reporting is delivered in aggregate. It's de-identified, so you wouldn't be able to identify a certain student, but I know that there are some groups on campus that may not want everyone to be able to access their responses to ScreenU. And so we can identify a department that we would want the campaign to be associated with. In this case, we identified the athletic department. And as a campus administrator, you can add an unlimited number of users to ScreenU, other campus professionals that would have access to this dashboard. Once you add them as a user, you can assign them a department, and only those users who are assigned that department would have access to that campaign and its associated reporting. So only those associated with the athletic department would be able to see this campaign. We also are able to activate and deactivate the campaign. The system will do that automatically for you by setting a start date and an end date. And you'll see below part of the welcome message. So this is also the page where you have the opportunity to customize your thank you message and your welcome message. Once you've created your campaign, then you'll come to this page, which is just giving you some basic information about your campaign, but it's also giving you opportunities to distribute your campaign to students. So there's a few different ways that you can do that. One of them is we have a screening link here, and we can just distribute that screening link to students. So we can email them this screening link, and then they'll have it to be able to utilize. But we also have the option of identifying students for screenings, and we can identify those groups of screenings to be able to track completion of ScreenU. And so to do that, To do that, we would upload a CSV file of all of the email addresses that the student athlete campaign would go to. So all of our student athletes on campus, we would put in a CSV file, their email addresses, we would upload that to the system, we provide a template for you, and then you also have the ability to customize an email on this page that then would be sent to all of those students. They would receive the email that you customize as well as their unique collector link for ScreenU. And once they take the screening, you're able to download an identified student CSV. You see that button at the bottom, which will show you the email address, their unique collector link, and a timestamp for when they completed it. This CSV does not have any reporting on it. It is not tied to any specific screenings. It just shows you whether or not it has been completed by a student, which is great if you're using ScreenU in systems like Conduct, where you may be interested in tracking completion, and that might be really important to you. Our campus resources page is where you would upload those local resources on your campus and within your community. You can do that for each individual program as well as recovery. So that's what we're looking at right now. Here's where we would upload our recovery resources. As you click on the Add Resource button, you're able to add resources to any or all of those at the same time, but you would input the contact information. You have the ability to edit those, and you can add as many resources as you'd like to the system in each category. Students don't see these categories. The system uses them to automatically populate certain areas of the feedback and resources that students do see, and any resource that you add that isn't automatically populated within the feedback, students receive as an additional resource at the bottom. And so now I'm going to show you a few screen grabs from reporting, and I encourage any of you on our webinar to set up a demonstration account, and you'll have a better opportunity to kind of review what reporting looks like. So here are some of our reporting from our test campaigns, and once you move to our reporting, you're able to see some of the graphs that we're going to show. So we're able to look at screenings over time and when those screenings were collected. We're also able to see if we utilize that students identified for screening, we email those unique collector links. We're able to see for a campaign how many of students completed it through that identified screening link, and how many of those are still outstanding. So for this particular campaign, we sent 32 out and only 4 were completed in that way. And then we're able to see our risk levels overall. We also are able to look at overall demographics of the campaign. So overall, what was the gender breakdown, the age breakdown, the class rank breakdown. We're able to see how they responded overall with their risk level. As you hover over these donut sections, a bubble will show you what that area is representing in percentages as well as raw numbers. And then once you click on that category, it'll also break it down by those demographics. So of the 41 students who indicated that they were in recovery for this campaign, 8 of them were male, 19.5%. And it does this for all of the demographics that we have available. And then for every single question that we ask during the screening, you're able to see how students respond, and it breaks down by demographic as well, just like the risk level did. So I want to transition and talk a little bit more about how campuses are using ScreenU. So we've looked at the screening, we've looked at some of the pieces of the administrative dashboard. Anyone who's interested in learning more about the dashboard, we're happy to set up a call offline to do that. We want to talk a little bit, though, about how campuses have utilized it. We spent about 15 months piloting ScreenU in almost 30 campuses across the country, and those are represented in the light green color on our map. So you see kind of where some of those campuses were. And that really, the pilot process provided us some really valuable feedback on how campuses are utilizing it. It gave them opportunities to brainstorm with each other and to figure out some of the challenges to implementing. We found out some really great suggestions for how to implement, and I'm going to share a few of those with us today. But when we think about where we can use ScreenU, really it can be anywhere. Because students just take it on their phone or their tablet, it can be implemented in lots of different areas, lots of departments. We talked about clinical settings already, like student health services or maybe counseling centers, but it can also be utilized with our academic advisors, with fraternity and sorority life, with our athletes, within student conduct, and it can be utilized with outreach events. And we also want to mention that one of the things that can make SBIRT really effective is universal use of SBIRT and using screenings, getting people accustomed to screening for substance use disorders the way we're accustomed to screening for other health issues. So we are used to having our blood pressure taken every time we go to the doctor. We should become more familiar with using screening for substance use disorders, particularly on our campuses, because it's a high-risk population when it comes to alcohol use, in particular around how much students might be consuming. And so here's an opportunity to screen universally, and maybe that means screening your entire student body once a year. Every fall students are screened, or maybe it's every spring students are screened, because maybe you do a lot of education in the fall when students first come on campus, but maybe we're not doing quite so much in the spring around alcohol or other drugs. And so that would be a good time to use a screening. And also when we're looking at targeted populations, being thoughtful about when we deploy screenings with them as well, and we'll talk about that in a moment. So when we talk about using ScreenU in a clinical setting, we've had a couple of our campuses do that in their waiting room of student health as well as in their counseling center. And campuses have done it different ways, so this is one of those times where we can learn from how people have done it and then adapt to what works for our campus. So we have some campuses who have used a community tablet. Others have just posted a screening link and students take it on their device. It's been reported to us, though, as at one campus, they would offer a tablet and just suggest that students take ScreenU, and by and large the majority of students would do it just on that suggestion, encouraging them to complete it. The risk level that a student has can be self-disclosed to a practitioner, or because we can download that resource page that indicates their risk level, it can be provided by email as well, depending on what would work best in your setting. So I'm going to show you an example from Clemson University, one of our pilot campuses, and what they did. So they had students take the screening in their waiting room, and as they gave students the screening link, they also provided them with one of these cards. It was just a small postcard-sized card that allowed them to indicate on the card what their risk level was. So it protected the specific responses, so a healthcare practitioner wouldn't see how they responded to each of the questions, but they would see their overall risk level from, this was specific to ScreenU alcohol that they were using. And so when a student it was their turn to see a practitioner, they handed that card to them, and the practitioner could have a discussion based on their risk level. Other campuses have just asked students as they've come in the door, did you complete ScreenU in the waiting room? And do you have any questions? Would you like to talk about the screening that you took? And so that can be a way to open the door for having conversations. We have a number of campuses also using it in conduct settings, and those campuses who are using it, some of them look at it as kind of a triage for students. So an opportunity to identify what would be the best intervention for a student who might have a conduct sanction that is related to alcohol or other drugs. So for example, if a student has a low-level sanction, they move through ScreenU and they're at a lower risk, it may not be worth the time to refer them to Basics, which is a great tool, very effective, but when it's done to fidelity is 2 one-hour sessions one-on-one with someone. A lot of campuses don't have the capacity to do that. And so let's reserve the time for students who really need that, who are screening at a moderate risk and at higher risk, and then get those students in the door to Basics. And maybe that student who is screening at low risk would benefit just from an educational course that can be done in a group setting that wouldn't be as time intensive. So there's opportunities to utilize ScreenU in a way that can help save on resources within your office. It can be done in advance of meeting with a conduct officer. It could be done in partnership with a conduct officer. So it's up to a campus to determine what would be the best way to implement it. We've had some campuses that include screening links in their email or use that identified student email feature that we discussed on the dashboard. So again, lots of options on how it can be implemented. And then conduct officers can use that resource page that indicates the risk level at the top to determine what their best recommendations would be for that student based on their risk level and the type of sanction that maybe they received. We've had a couple of campuses that have been screening athletic teams. We've done that here at Ohio State as well. And one of the things that we learned here at Ohio State was it was really important to gain buy-in not just from the athletic department, but from the coach as well. And we were really lucky to have a great champion in our athletic department, our sports psychologist, who thought this was really important. And so she really helped make those relationships between our university wellness office and the athletic department to be able to implement ScreenU by team with some of our higher risk athletic teams. So the way we did it here was we sent an initial email with the screening link, and that came from our sports psychologist through the athletic department. So that the initial email was sent from the athletic department, and then the coach followed up after that email was sent, reinforcing the importance of completing the screening. Now here at Ohio State, we actually tied the screening to our the Blunt Talk marijuana education class that the athletic teams were required to attend and participate in. So through the email, it indicated that students, to be able to be at that training, this was kind of their ticket in, was the certificate of completion. With the coach's reinforcement of the importance on this, we actually had 100% completion rates with our athletic teams, which was really fantastic. ScreenU can also be a tool in the toolbox for lots of other groups. So academic advisors can just have access to it. Maybe they're not implementing it universally, maybe they are. But if they're concerned about a student that it is struggling academically, then this can be a great tool to use to identify, well, is alcohol or other drugs maybe one of the reasons why that student is struggling academically. Residence life and fraternity and sorority staff can have access to ScreenU to be able to use with their chapters or with their floors, with students who are they might be concerned about. And again, we want to encourage universal use as well with the tool. So screening an entire fraternity or sorority chapter as part of their risk management plan can help fraternities and sororities be a little bit more proactive about alcohol misuse within their sorority or fraternity chapter, and show that, you know, we're concerned about this and this is something that we're doing on an individual level, making sure that those chapter members have access to the resources that they need. We had a discussion recently with some faculty here on campus around how they can utilize ScreenU, and so many of our colleges require including access to or information around how to access mental health counseling and some of the other resources that are on campus as part of their syllabi. And so including a link might be a great way to just make ScreenU aware to students that it's available and something that they can take part in and have access to. Those ScreenU links can also just live as a hyperlink on a website, so you can refer people to your campus wellness website. You can refer people to your counseling website to be able to complete screening links. And one of the things that also we did here at Ohio State was we shortened the link so that it wasn't so long, because our initial links are lots of characters. We used, we have a system here called go.osu.edu that allows us to shorten links, and so we did that. It still looks like it's coming from the university. And then we printed it on some promotional items, including a portable phone charger, those battery packs that you can use to charge your phone up when you aren't near an actual charger. And through the distribution of those portable battery packs, we collected over 600 screening links. So by including those screening links on promotional items, then students have access to those to be able to take the screening link on their phone. even if your campus doesn't have the ability to have customizable screening link, shortened links like we can, there's lots of systems out there. Google will shorten links for you and as well. So I very quickly ran through lots of ways that campuses are using ScreenU, and I encourage you to ask some questions. I know we have some questions already sitting there that we'll get to in a moment. I want to talk about a few next steps that you can take if you want to learn a little bit more or have a more customized conversation around ScreenU and how it might complement the prevention efforts on your campus. I encourage you to visit ScreenU and learn more about the tool. You have the opportunity to sign up for a free 7-day demo that will give you access to the dashboard that we were looking at through our website, ScreenU.org. I encourage you to gather some key stakeholders and have some conversations about implementing SBIRT, whether that's in person or using our tools, and start thinking about the resources that you have on your campus that would be appropriate to add to ScreenU. As I mentioned before, we're happy to schedule a one-on-one demo where we walk you through the programs and talk about how it might work on your campus. And you can do that by visiting go.osu.edu/ScreenU demo. I'm going to start taking a look at questions. I know we have some. I encourage you to, if you have them, to send them in. And our first question is a great one. Are all of your ScreenU modules based on a gender binary? Are there options other than male or female? And the answer, Kathy, is no, they are not based on gender binary. We have, I think, 7 or 8 different options for gender, and perhaps I think this question came in before we looked at the breakdown for gender. That one graph that I showed you showed all of our the different gender options that students can pick. So we tried our best to be as inclusive as possible when considering a gender with ScreenU. So the next question is, we would like to use ScreenU in our SBIRT implementation. What range of the audit scores would be best matched to this intervention in particular versus basics? And I'm not quite sure. Would you like to use ScreenU? Which intervention you're talking about versus basics. I would encourage anyone who scores at a moderate risk or higher to be referred to basics. And then students who are at a low risk, which is a 0 to 7, they might be best to experience just some education. And we've had a couple questions around the efficacy of ScreenU tools, and that's a great question. It's something that we're working on now. So if you're interested in helping us evaluate ScreenU on your campus, reach out to us. We have had limited studies around the evaluating ScreenU in particular. However, as we've mentioned, we followed the principles of SBIRT. There's a lot of efficacy around delivering SBIRT, or a lot of evidence around delivering SBIRT in a web-based format, and so we feel good about the way that it has been structured. We look forward to continuing evaluation efforts of our ScreenU tool in particular, though. So we would love for anyone who is interested in partnering to reach out to us. Another question, which is a good one and one we hear a lot, are campuses using this resource instead of e-checkup to go for marijuana and alcohol? And I would say no, not instead of. I think they partner really well. They complement each other nicely. In fact, here at Ohio State, we use both ScreenU and e-checkup to go. So there's a lot of, e-checkup to go, again, is a evidence-based program ranked highly in the college AIM, and there's a lot of great uses for it. It's not SBIRT, and so we see ourselves as a digital SBIRT program. And again, they can complement each other really nicely. eCheckup to go might be that nice education piece. If you don't have the capacity to offer something in person, perhaps a low-level sanction, a nice recommendation would be for them to move through eCheckup to go. So no, we don't see ScreenU necessarily taking the place of other prevention efforts that you have. I think another thing to be thoughtful about is how you're implementing some of those web-based programs. Things like alcohol EDU might be done pre-matriculation. And then are students receiving any kind of contact around alcohol after after their first 6 weeks on campus? So that might be an opportunity. ScreenU is short. It's easy for students to take it multiple times over the course of their time on campus because it doesn't take the 20 minutes or 40 minutes other web-based programs might take to work through. And so we encourage you to use ScreenU as a complement to the prevention efforts that you already have on campus. How does one refer is another question. Can a student check a box to be contacted by someone? So right now, there's a couple of ways that you can do it. The way the system is set up right now is students have to take the initiative to make that next step unless they're working in partnership with a campus professional who can facilitate that warm handoff. However, there are ways, because that thank you message is customizable, you have the ability to create a link to be able to connect out to students. So in that thank you message, if you want, you can develop a link that would allow them to directly to send an email encouraging Counseling Center, for example, to reach back out to them. There's some options that you can customize there that would live outside of our ScreenU system, but would still provide the opportunity for students to connect with resources. And we were happy to talk a little bit more about some of the logistics of how that might work individually if you're interested. And then I think our final question is, what has been the reaction or feedback from clinic and healthcare providers to ScreenU? So I think from our pilot campuses that we've talked about, it's been really positive. One, because it takes a little bit of pressure off of providers when it comes to using ScreenU. They don't have to be the ones to administer that screening, and so that saves a little bit of time on their end as well. And one of the nice things is it tabulates everything for you. So if you're looking at using the screening responses in any kind of way, data-wise, someone has to tabulate if you're doing it by paper and or in person. And so ScreenU does all of that for you. So that's been some of the feedback that we've had from clinicians. So I think I got all of the questions. I'm happy if you have any questions, you can reach out to me at hecaod@osu.edu. We have a couple last things that I just want to mention. ScreenU is available through purchase of a premium membership through the Higher Education Center. It grants you unlimited access to ScreenU alcohol, prescription drugs, and marijuana, and that includes all the implementation, any kind of limited training that you might need, as well as technical assistance. In addition to access to ScreenU, the premium membership provides a number of other benefits, including access to our member listserv, free access to our Cannabis Learning Collaborative and our upcoming learning collaboratives around recovery and prescription drug misuse, as well as access to our recovery ally training that will be launching this summer. So all of that is included in our $2,500 membership fee. Those of you who are a part of the Cannabis Learning Collaborative, and I saw there were quite a few of you, I want you to save the date. Hopefully you got your email today about asking the expert or ask the expert session, which is the final component of our Cannabis Learning Collaborative. It's taking place Wednesday, May 31st at 2 o'clock. So those of you that are interested and available, we'd love for you to register and have an opportunity to ask our expert, Dr. Jim Lang from San Diego State, any questions you might have had about marijuana. What are the things you've always wanted to know? He'll be happy to answer those. In your email that you received, you had the opportunity to submit questions in advance. So even if you can't be there with us live, I encourage you to submit those questions, and we'll be recording and archiving this session on our member portal. If you're not a member of the Cannabis Learning Collaborative and not a member of the Higher Education Center, you can still have access to the Cannabis Learning Collaborative. Feel free to reach out to us. For $100, you gain access to 8 archived webinars, as well as you can still be a part of our live Ask the Expert session. Again, I encourage you to reach out to us at hecaod.osu.edu, or here's my email if you have any questions or would like to follow up after this webinar. I want to thank you for taking the time to join us today. If anyone has any questions, would like to talk a little bit more about how ScreenU might fit on your campus, please don't hesitate to reach out to us. I hope to hear from or see most of you next week's Ask the Expert session. Everyone have a great afternoon. Thank you so much.